On the island, we do it island style. From the mountain to the ocean, from the windward to the leeward side. On the island, we do it island style.
Hello everybody and welcome back. You're watching Rise Above Big Island, or Rise Above Hawaii, which is a 30-minute talk story on health. And I'd like to talk a little bit today about medical care and about our communities. And we have a special guest, as usual. I'd like to introduce to you Dan Domizio from our community health medical center out in PUNA. Tell me a little bit about it. Did I get the name right?
PUNA Community Medical Center.
There you go. There you go. Tell us a little bit about it.
PCMC. Well, first a little bit more about myself. I'm a physician assistant, and that's important. That's a key factor in all of this.
Okay.
PUNA Community Medical Center came out of nowhere. The PUNA Community Development Plan said if you guys want to have any increased access to health services in Lower PUNA or in PUNA, you're going to have to start a new corporate entity with that as its agenda. The community health centers were over the top. There was no private money interested in doing it. The Hilo Medical Center was scratching at the bottom. And so it's like, well, if we need to have some alternative to driving 30, 35 miles to Hilo Medical Center emergency room, we need to create an urgent care facility right in Pahoa.
Wow.
And so it was, well, how the heck do you do that? How do you create a corporation? How do you get a nonprofit status? How do you get, and it started out from nothing. And,
really?
And that's why I said the important message for everybody out there is that there's nothing that we did in Pahoa that couldn't be done elsewhere. With the right indications for having an urgent care clinic, we could do that. You could reproduce what we did anywhere in the state.
And that's good to know because, you know, we are in a health crisis, okay? And even the federal government has recognized that. So we have, you know, health reform. We have incentives to provide better care. We have payer reimbursement exchanges that can look different from prior setups. So this is a good time for health reform, if you will, a good time to implement programs such as this. Don't you think?
I think, absolutely.
Okay.
I think, you know, the impetus coming out of Washington is like communities in need to get a grip.
Yeah.
They need to find their own leadership. They need to make their own initiatives happen. And what happened with PCMC in Pahoa was a perfect example of how a cooperative spirit, you know, a bunch of driven people saying we've got to do this, can result in some really extraordinary things. You know.
That's great. Let me ask you this, just so our viewers can know this too, because I'm not very much aware of the health field and how it, like, okay, so we have Hilo Medical Center.
Right.
That's for urgent needs, emergency
needs, right?
Okay, and then we have, private physicians.
Right.
But then we have urgent care, which is a kind of a different setup.
Right.
Kaukai Express, we have
Hilo Urgent Care.
Yeah, Hilo Urgent Care, Pahoa Urgent Care, is there something?
Pahoa Community Medical Center. It's got a big name.
Okay, it's a bigger name.
Tiny place.
Okay. Now, how does that all fit in? Well, what else do we have? Are we missing?
Yeah, well, you've got the federally qualified health centers that are in there.
Okay, right, like Bay Clinic.
Bay Clinic has
Hamakua
got,
Health.
yeah,
Okay.
Hamakua in Honoka'a. We got Bay Clinic in Hilo, Keau, Pahoa, and Ka'u. And they're federally qualified health centers. You got the private practices, and then you've got Hilo Medical Center, the community clinic that provides urgent care for anybody.
Right, and these are options to us. So if we get sick, of course, if we're in urgent need, we go to the Hilo Medical Center.
Right.
If we think it's real bad, if we think it can be handled by our own primary physician, we set up an appointment, but we probably won't get in.
Right.
Because, you know, so then we have these options. We could go to an urgent care.
That's right.
For a quick check.
That's right. And unlike the other urgent care centers that we just mentioned, this PCMC is nonprofit.
It's nonprofit.
There's a not-for-profit thing. We see anybody. There's no cash up front.
Oh,
you know, which is a very different thing from Hilo Urgent Care
Okay.
and Calca Express and KAO Urgent Care. People walk in the door, no appointment necessary. We have a sliding fee scale. 20% of the patients walking through the door have no insurance, and very few of them have, a lot of them don't have any money either.
oh,
So
wow.
when that happens, we are looking at saying, yes, we will help you out, or no, we won't. Well, we never say no.
Oh,
We never, there's got to be some really strange set of circumstances for us to say to somebody, I'm sorry, we can't take care of you. And those circumstances are like, we need permission from your primary provider to take care of you if she or he are accessible. On a weekend, on a holiday, their office is closed. We don't need to get their permission up front. But if their office is open, we need them to give us an okay
Yeah.
to take care of you. So a little bit of a hang-up,
that kind of stuff.
but we're not the ones who say no.
Yeah, you say yeah.
We say yes.
Well, how do you fund yourself then? I mean,
Well, insurance, for those people who have insurance, we have, you know,
you can bill?
Yeah, we
So
bill.
you can bill Medicaid?
We build Medicaid, Medicare, and HMSA, and all the other
Okay.
private insurances,
Okay.
right? But the key for us, and everybody should understand this, that the mayor and the county council give us money every year to take care of those people who are uninsured. It doesn't cover all of the expenses, but without it, we wouldn't survive. There is no way we could keep that very, very expensive promise to see
Oh.
anybody, whether or not they have
You mean
insurance.
even with, because the state is a Medicaid, Medicare situation, so the state kind of gives, through the insurance, opportunities for you guys to reimburse, so you can get money there, but even on top of that, you need some
Sure.
county money to kick in.
Absolutely, you
Okay.
know, and this year, we're getting $115,000 from the Hawaii County nonprofit grant, and that's amazing. $115,000 will assure that we pay the rent.
Yeah.
We pay the phone bills, we can buy the bandages, we can have the
Wow.
have the medicines and whatnot.
So thank you, Mayor Kanoy and your administration.
You bet. No doubt about it. And,
Wow, I didn't know that.
I have no political bias here. Frankly, no one has ever said no to us.
Wow.
Everybody wants us to succeed. And, you know, the fact that we've had almost very close to 12,000 visits in the 2.5 years, 12,000 times
Wow.
people have come in,
Wow.
you know, and that's 7,400 individuals
Wow.
have paid 12,000 visits. We have mostly local folks, but it's also people from 35 different states and 15 different countries. A lot of visitors, you know, a lot of people fall down on the lava and they scratch their leg, or they run out of their diabetic medicines and they can't get a prescription from home and whatnot. And so we said, sure, come on in, we'll do what needs to be done and take care of you. And so and we have no advertising. This
Okay.
is all by word of mouth,
And this is right in Pahoa town.
right smack in the Pahoa market.
What's the next closest health center? Is there
About
a
a mile away is Pahoa Family Health Center.
Oh, okay.
That's a Bay Clinic.
Now, is there concerns of competition between the two health centers since it's only so close apart, or is there enough clients
Oh, no.
or patients to go around?
You could build a whole another facility down there and still be overwhelmed. I mean, it is the most rapidly growing part of the state.
That's true.
And, you know, when the Pahoa Clinic gets overwhelmed or the KAO Clinic gets overwhelmed, they send patients to us. On the weekends, again, they're not open and we are. Your
Wow.
kid's got an earache or
Yeah.
you fall down and cut yourself. It's either us or the emergency room,
That's right.
right? And
It
so
costs money, the emergency room,
it
yeah?
does cost money. It costs the insurance companies money. And so the insurance companies money are very, very happy to have us there. And we're trying to negotiate, hey, guys, you know, if it costs you $15 at our clinic and it costs you $500 in the ER, why don't you cut us a break and reimburse us something in the middle?
Yeah.
Not the $15, but give us something more. So that's
the-
a negotiation that we have out there all the time.
That makes sense, because isn't the role of the community medical health centers to decrease readmissions or admissions to the medical
Sure,
center?
absolutely.
Because of the skyrocketing costs. I think nationwide, that's the issue.
Sure.
So I think the federal government has incentivized communities to, be a precursor, if you will, or a mediary to the emergency room.
Sure, absolutely. And Howard Ainsley, the CEO of Hilo Medical Center, is very much in support of our next step, which is the building of an emergency room right next to the new police station and firehouse. in
Wow,
Pahoa.
there's a next step?
Yeah.
Tell us about it.
That's why it's got this big PUNA Community Medical Center for this teeny tiny thing.
Oh.
We said we were going to make a Band-Aid.
Yeah.
And we've got a Band-Aid, but we realized the population's growing like crazy, that we need 24/7 services.
Yeah.
We need emergency room services with X-ray and laboratory and, emergency room physicians and PAs and whatever, who are providing services all the time.
That's true.
And so Howard and his staff up at the medical center are saying, go for it. We would take a lot of stuff down our end of the Highway 130,
Yeah.
the most dangerous road in the state, right?
Yeah.
And so everybody's saying, let's see what we can do. And we have this little bit of a not a promise, but a little green light to go ahead with this idea. And the mayor's office is looking into those people who would be providing permits
Yeah.
and stuff like that. So,
Yeah.
who can we, well, that's state land where the
Yeah.
police station is, and the county rents it. And so we would be subletting it, if you would, from the county. So we don't know if we're on solid ground there
Yeah.
or not. But it's 15 leftover acres.
Doesn't hurt to try.
And putting an emergency room, the firehouse loves it, the EMT guys love
It's
it.
right there.
I mean, they would be parking their cars right
Yeah.
next door, so it would be wonderful.
I like that. The title of the show is Rise Above, and I like when I talk to folks who dream, who have goals, and who do everything in their part to meet those goals. And so you obviously have some goals. You're starting off small, but you want to expand.
Yes,
And the need out in Puna is great,
yes.
and the healthcare needs are overwhelming.
Yes.
Nobody's, Bay Clinic doesn't have to worry about you taking pays. So in fact, you could build another center and still.
That's right.
So-
And Bay Clinic would not object at all to having an emergency room right up the road instead
Right.
of all the way into
That's
the
right.
Hilo Medical Center. And since we have opened the little urgent care thing,
Yeah.
the emergency room utilization in Hilo has dropped. From our 96778 zip code, there is a measurable drop in demand in the Hilo ER. And they've measured it. So they're the
That's
ones who
right.
are providing us the number.
I've seen those stats. It's like that. At the Health Fest recently, Renee Saracusa was managing the booth, your folks' booth there, and they had some slides, and I was looking, wow, it has dropped, and which means then they can pay attention. The medical center can pay attention to more urgent, more quote emergency needs
Absolutely.
than the ones that
Yeah.
because I think there's a large number of folks who overuse the emergency care.
Absolutely.
So-
The emergency room is the primary access for a lot of people, and it shouldn't be.
That's right.
It shouldn't be. And basically what the difference would be is we would be a freestanding ER down in Pahoa. There would be no hospital attached to it. So anything that needed to be admitted for appendectomy or deliveries or whatever, obviously would go into Hilo. So right there's a distinction. So the Hilo Medical Center could focus on its emergency services and its inpatient services, surgery and otherwise. So it's a fit.
Yeah, it makes for a good fit.
It's a fit.
Yeah.
And Howard Ainsley and I went recently to the Waianae Coast Comprehensive Health Center.
Yeah. With Dr.
And-
Ricardo?
Yes,
Yeah.
and Ricardo and myself are old friends and colleagues, and I used to work at Waianae Comp, and it's been our model. They
They've done it?
loaned us their bylaws, they loaned us their articles of incorporation, they provided the model, and we said, well, what we would like to do really is take the Waianae Comp and put it in Pahoa.
Yeah, that same model.
Birthing center, adult daycare, mental health services, all the stuff that we are desperately in need of. of course, it isn't you build it and they will come. We're talking about the drastic need for service providers.
Now,
where the physician's going to go.
That's right, yeah, you still need to get your workforce
Right.
going. Now, is that a federal qualified health center,
Yes.
Waianae Coast Comprehensive?
Yes, that's the big brother
Okay.
of the health centers.
Okay. Now, what's the difference between a federal qualified health center, like Bay Clinic, and a rural health center?
Well, a rural health clinic doesn't provide all the broad spectrum that a federally,
Like
behavioral health and wraparound services, pap smears and mammograms and women's health and immunizations for children and all that preventive care. So what we're trying to do is we're saying, okay, we need to get federal dollars and we need to get state dollars. We need to be recognized.
Mm-hmm.
And so we are right now applying for a rural health clinic status. We're in the process of
Right,
doing
just to
that.
get recognized. Now, tell me a little bit about your staff. So you're the assistant to a physician.
Right.
Who's your physicians?
Our medical supervisor is Dr. Hart Miller, who is a family physician. He works part-time. I'm the director, and I'm a physician assistant, and there's another PA that works part-time with us. So that's the provider staff right there, and PCMC is another important model for the state of Hawaii, and this is why I said earlier, it's important that people know I'm a PA, because this is the only PA-led facility in the state.
Really?
Yeah.
And it's all legal and it's all good?
It's all legal and
in
it's
fact,
all
people
good.
encourage it.
Right.
Because it's cheaper?
Well, it's cheaper. It's a different model. PAs don't work without physicians. Physicians and PAs work as in teams. There's a quality of care issue that is fulfilled. There's patient satisfaction is fulfilled. There's more access. And what I've been saying for the 20 years I've been in Hawaii is, why not Hawaii? Why doesn't Hawaii use more PAs? If you think about all of the places in the
That's
country.
right, because we do have a physician shortage, but if we have physician
Right,
assistants that can
then
do much of the work.
You can have a doctor and two PAs, and the practice a closed practice with one physician adds a PA, now you got 50% more people can go into that
That's
practice. As two PAs, you got 100% more people can go into that practice. Why not?
How do you become a PA? You have to be a nurse or something?
No, you have to have clinical, you could be a nurse, you could be an EMT, you could be a medic from the military, any prior healthcare experience,
Okay.
and then you go into PA training. PA training is about 2/3 of the training of a physician in terms of time, and generally speaking, PAs are older when it's a second career.
Oh.
They're married, they have families, the average age of people admitted into PA programs is around 30, and it's 50-50 men and women.
Okay.
So medical students, on the other hand, are coming right out of college.
Yeah.
They haven't had that career yet. They're going into medical school and so on. So it's a different formula, but the mindset is practicing medicine.
Okay.
You think alike and you react alike, and you have the same kinds of perspectives in terms of patient care.
Okay. How did you get involved in healthcare, and why does this light your fire?
Oh well, I've been doing community organizing since I joined the Peace Corps 40 years ago.
Oh, the Peace Corps.
I was a New York City guy, and left New York in 1966. And where did I go but to the east end of Molokai? I spent 3 months in a tent on the east end of Molokai training to be a Peace Corps volunteer.
Wow.
And from there I went to Micronesia. But that was the birth and the genesis of my relationship with Hawaii. It's been a long time.
I've never ran into somebody who didn't work in the Peace Corps that weren't culturally sensitive and culturally competent, and it's something about Peace Corps folks. I mean, is that part of your New York, is that that diverse place? How did Hawaii,
well, was
it easy to connect?
Hawaii talks about diversity, but there's more diversity in one city block in New York City than there is in this entire state.
Yes.
You walk down any midtown street and you'll see everybody from any place on the planet. So New York is diversity.
It is diverse.
But joining the Peace Corps, you go out and what do you become? You become a member of a minority.
Yeah.
All right, you're a cultural minority, a linguistic minority, and so all of a sudden you're root perspectives are flipped upside down, and you're on the bottom looking up. Of course, you're empowered. As a Peace Corps volunteer, you always have some level of empowerment, but it's like the purpose of you being there is to take care of people, whether you're a teacher or a farmer or a health worker or whatever. So once you start doing that, it's like it's really addictive.
It's amazing. It's being addicted to people and to helping. Nothing wrong with that.
No,
in fact,
absolutely.
we could use more of those types of
Absolutely.
addictions. Huh?
Absolutely, no problem at all with that. You know, if you would take it in one way, the PUNA Community Medical Center is like my postdoctoral community development work. You know? And when it has succeeded beyond anybody's dreams, it's wonderful, and people are happy. People happy working there, people are happy coming through the door.
It's a great idea, and it's a great idea in action.
Yeah, it's all meant to be user-friendly.
Yeah.
You know, it's quiet, it's not clinical.
And they don't have to drive all the way to Hilo.
Absolutely.
You know, it's making PUNA not the second, not the stepchild. Because a lot of people from PUNA feel like, Hilo is all the services, and we need to see eye to eye. And I think when we have services like that, where people don't have to drive, it gives PUNA, that whole community, that sense of empowerment.
Yeah, and it's also nice to know, and everybody should know, that everybody who works there lives there.
Yeah.
The whole entire staff is from that community, and there isn't anybody who is an auntie, cousin, uncle, brother, sister, whatever, to somebody on the staff.
Yeah.
And in our staff, we have people who can speak both Philippine dialects, and I can speak some Micronesian, and so we're able to reach out a little bit.
That's awesome.
With the folks who come by.
We might take that for granted, but I tell you, we had Auntie Sandy Claveria on here on our show a week ago, 2 weeks ago, and she talked about connection. She talked about that community connection for education. But I think that community connection also for healthcare is really important too. When people feel safe, when they feel connected to their healthcare provider. When they feel understood, and when that trust level is there, I think that makes a big difference for them in wanting to stay healthy. And
Sure, absolutely.
healthy.
I mean, and every time somebody walks into that little exam room, that little crucible of the exam room, it's like you close the door, and it's whatever's going to happen. And in our clinic, we think of each encounter like that as an opportunity to empower people.
Thank you. That's very important.
To educate people. When I walk out, there's some contract that has been developed, and it takes a little while to get as skillful as we are to be able to come to that meeting of the minds with the mom and the dad and the kid. And well, okay, you're going to walk out the door, and you're going to do what? And I'm going to do what? And then let's talk on the phone. And so for us, making telephone follow-ups.
That is so amazing.
Call mom the next day, say, how'd the earache go?
Yeah, that's very important. I did some research prior to this interview. I just wanted to see the amount of time that traditional physicians spend with their patients in terms of conversations. 23 seconds. Remember that, folks. This is it. Physicians, this is a study across the board, let their patients speak 23 seconds. That's about it. And then they speak for another 2 or 3 minutes if you're lucky, and that's the end of the encounter. Okay, so I knew this research, so I wanted to test it. So I asked my sister if I could go along with her to a doctor visit, and 23 seconds. In fact, maybe less. I mean, she had something, and she didn't even have a chance to kind of talk about it, and he said, well, it's this, it's that, we don't really know what's happening here, and you need to go here, and I'm going to write this up, and you can get it from the nurse. Gone. That's it.
Yeah.
And so we need to change. And that was a specialist. Now, we walked out not feeling very special. Okay. So, and that's big dollars. We would expect more of a conversation. What do you know about this particular illness? Does anybody in your family have this? How do you feel about getting it? Is there any questions you might have?
Right.
Have a conversation.
Right. Well, it's sad but true. And anybody who practices medicine for a while understands that 75% of what you need to know is what the patient's going to tell you. So if you only got 23 seconds, that's not a whole lot of information, and you got to go gathering it someplace else. You know, the absence of specialists and the absence of people in this community is really disastrous. I mean, we don't have a neurologist, or we don't have a urologist, or we have one but not three, and you know, we haven't got a surgeon on call, or whatever it happens to be, and it makes it really difficult to put it all together. But part of the responsibility for that rests with the medical community itself.
I see.
And you know,
time is money. Is that what it is? Time is money.
Well,
Get them out, in and out.
Well, it is that. You know, when you're so very busy, and your practice is completely full, why do you then go ahead and resist? Well, just as an example, and I don't mean to why do you resist? If you're an obstetrician, why do you resist the utilization of midwives? We got more service providers. Why do you resist a family physician, fully trained family physician, who comes to Hilo expecting to be able to deliver a baby and can't get access to the delivery room? How is that?
Yeah. You know, how is that helpful? How is that helpful?
You know, who benefits from that? You know, and and then I'm talking about using non-physicians to do physician things. Yeah. Nurse midwives are the providers of choice. If you go up to Waimea, women want to go to the midwives. They want to go to Waimea. Waimea is the class act on this island in terms of your experience in childbirth. Why can't we create that in Hilo?
That's true.
You know, why is it so locked up?
Are we afraid of attorneys and suing and liability and all that, or
what is different up in Waimea?
Same, man. Yeah, good point. Good point. What's the difference?
It's like why, you know, PAs in Hawaii? Why not Hawaii?
Yeah, that's right.
You know, PA and nurse midwives in Hawaii. Why not Hawaii? You know, you got them in Molokai because nobody else wants to go to Molokai. The nurse midwives have done a splendid job over in Molokai for decades, right? They're doing a splendid job in Waimea. They would do a splendid job anywhere. But why put barriers?
Why put barriers?
Why put barriers? Whose needs are being served with those barriers? You know, that's a question.
That's a good question.
That's a question that really we need to have a bigger table with a lot more people around it to talk the story with. You know?
I like that question. Whose needs are being met when we put barriers? Dan Domizio said that.
You got it.
Let's keep that question going.
Yeah. No, at the mayor's healthcare conference a year ago. It was in August last year. Yeah, it was a year ago already. You know, I said, "Where's the stash?" I said, everybody's got their own little self-interest stash in their pocket. Let's take that stash out, put it on the table, and look at it and talk about it. What's your stash? What's your self-interest in all this? What bit of the status quo are you protecting? All right? If we can't get honest about that, we're not going anywhere.
I like that.
They're not going anywhere. So that's you know, that's part of the formula here for not having access to care, not having specialists, it's not like we have no choices. We have some choices, but there's certain things that we just walk away from because it doesn't suit us.
You see, put it on the table, folks. Let us all look at it, because we may be better off if we put all our self-interest on the table, and we might have a bigger reward at the end, which is healthier people.
You bet.
Yeah.
You bet. And healthier people and people who have a sense of control.
Yeah.
You know, people who have a sense of, you know, I have something that I can do about this. That's one of the things that our little PCMC thing is all about. They can come to us anytime.
That's it. That sense of control is also ties into health. It's that self-efficacy. I can take care of my health. I have options. You know, and that's very important. What is some? We have a minute left. What is some advice you'd like to give the viewers, or maybe a take-home message from your experience at the PUNA Community Medical Center?
Well, I would think that if PCMC has anything to offer, as an example, is that as I said earlier, you know, there's nothing that we did that could be done elsewhere. You can't build a little walk-in clinic everywhere, but you certainly could put them 10 miles apart, you know, or 10, you know, in a different, you know, you could put something down in Hawaiian beaches. You could put something up in Kahala, or you could put something, you find a little set of circumstances, and you can do this, and it could be a community-based nonprofit organization that employs people locally.
Fantastic.
Yeah.
It can be done. Take it from Dan Domizio. Yes, you can. Thank you, Big Island. We love you, folks. Remember to always rise above. Ahui ho.
Ahui ho.
On the island, we do it island style. From the mountain to the ocean, from the windward to the leeward side. On the island, we do it island style.